All right, this is the seventh in the Neuro series on neuroanatomy, fainting, and the choke, going through some of the physiology and what to do about it. The topics for fainting are going to be a lack of blood flow to the brain, the vasovagal faint, which is separate from like fainting from low blood pressure. The other one is the performance freeze, choking under pressure. That's another term for performance freeze. And then talking about what the prevention and also the treatment for when you feel like you're getting faint. Well, fainting is really a general term, and it just means that your brain is getting reduced blood flow. Reduced blood flow is reduced oxygen delivery to the brain. And that can happen in several situations. The example I'm giving here is when people stand up too fast and their blood pressure doesn't equilibrate quickly and they get that sense of dizziness. The physiology is where the brain is not receiving enough blood flow. And some of the symptoms you'll get, of course, is ringing in the ears, and the medical term for that is tinnitus. Loss of hearing can happen after, you start getting the ringing in the ears, and then people describe, of course, dizziness, and then that tunnel vision as you reduce blood flow to your occipital lobe. Another example of faint is like when people have their knees locked. An example here is just from a YouTube video of guys, the recruits that are standing at attention, hot sun, and not moving. So they're standing at attention and they're not moving their lower legs. Now notice this guy that's standing at attention, he's starting to lose a little bit, and then he just passes out. This happens where people are standing and holding such erect or upright posture that they're not moving their legs at all. And your blood flow, your return of venous blood back to your heart is dependent on a couple of things. Part of it is the valves in your veins. Your arteries don't have valves, but your veins do. And the arteries get blood flow to the periphery, but there is no pump to take blood back to your heart. So the lower extremities depend upon your muscle activity of your lower extremities, and also they are dependent on these valves to keep forward flow. When your muscles are relaxed, those valves are closed, you have venous pooling. And when you contract your muscles, you will push the blood forward. So this is more of a depiction, a visual depiction where it's showing the blood is pooling in the lower legs when you're standing very still. And then laying down helps evenly distribute that blood flow. So the case presentation is a 18-year-old guy who, actually, this is a true story from when I was in my residency. He was being admitted for a workup of a heart problem called a cardiomyopathy, or a dysfunction of his heart muscle. And he was being transported in a wheelchair down to X-ray. And as they were bringing him back, he started to slump in the chair. And so the transporter dutifully held him by his shoulders, sitting upright in the wheelchair. And he quickly had a full seizure. So while being held in the seated position, he began seizing. What caused the seizure? You have a couple different choices. He has epilepsy, or B, he has lack of oxygen or blood flow to the brain. And the answer is lack of oxygen or blood flow to the brain. This is what's described as a vasovagal faint. Usually it's from like disturbing sights, smells, sounds, or even just thoughts. And that initiates stimulation of the vagus nerve, which is cranial nerve 10. That's parasympathetic. The heart rate slows and the contractility of the heart is reduced. So it's not generating a high blood flow. And the ultimate result is the blood pressure falls. If you remember the cranial nerves shown in this image that I found on Google, shows that the vagus nerve is being hidden right inside this guy's mouth. This is a great depiction of all the cranial nerves and what they do. And you have to almost study this to find the oculomotor, the olfactory nerve, optic nerve 2, 3. Oculomotor is the eyebrows, At any rate, cranial nerve 10, the vagus nerve, is called the wandering nerve, and it's shown in the back of the throat. It goes everywhere. And if you want to remember one not so sketchy mnemonic on old Olympus towering tops, a Finn and German viewed some hops, that's one mnemonic to remember the cranial nerves. And there's some others, and I would suggest if you want another mnemonic that is much easier to remember, but a little sketchy, you're going to have to Google that yourself. Cranial nerve 10, the vagus nerve, innervates several organs. It's mixed, which means that it has sensory input. It, for instance, in the stomach, it senses that the stomach has food in it, and then it has a motor arm that sends gastric acid production, or initiates gastric acid production, I should say. So it both senses and it also is able to respond. So if you notice this image, there's the ear and the vagus nerve coming down, and it innervates all of these organs, but it innervates specifically the ones you need to know about besides the stomach, as we talked about, are the lungs and the heart. And in the heart, it's the sinus node slowing down the heart rate, and also the lungs. It innervates the pleural cavity. So the example here is where the stomach has food in it. You have visceral input, and then you have sympathetic response where you have acid production. And a vasovagal episode is the term that's given to this connection between the heart and the vagus nerve, where the vagus nerve is attached to the sinoatrial node, and it slows the heart rate down. And a vasovagal response is where this arm is initiated, the parasympathetic arm, where you get this visceral response. You see it, you feel, you start feeling faint, and then you get this sympathetic response where the heart rate slows. And this is a picture with the snail on top of the heart. And this usually comes from an overactive vagal tone. And it usually happens when people are younger, and it goes away as they get with age and experience. So the next question, true or false? You can't go into medicine if you have passed out at the sight of blood. Is that true or false? And I hope you'll answer that that's false. Vagal overactivity, as I mentioned, decreases with learning experience. Here's an article that talks about how the vagus nerve changes with age. All right, another question, true or false? You are more likely to pass out if you haven't eaten. You hear this a lot, especially in the operating room, when people will come in, students or observers will come in, and the first thing people will say to them is, have you had breakfast? Is that true or false? And the answer is that's false. This is a vasovagal response. This is not regardless of dependent upon your blood sugar level, for instance. So it's not going to happen unless you're significantly dehydrated, you stand up too fast, or you're standing without moving your lower leg muscles. So the treatment for a vasovagal response or any kind of faint is getting down vertical, getting down horizontal, moving from the vertical position to the horizontal position. Excuse me, dogs want to come in and listen. So the treatment is place the person in the supine. The other thing you can do is get the legs up. That would be a very wise idea, is lift the legs up, put them on a chair, put the feet up on a chair, and have the patient or person lying down on the floor. The whole point is to get increased blood volume to your brain and your heart. And if you don't, you have an increased risk of seizure or brain damage with prolonged oxygen lack to the brain. Okay, another case scenario. This is about a blood donation. A young man seated next to you passes out while donating blood. You reach over and feel his radial pulse. His pulse is very slow at 38 beats per minute. What is your diagnosis? Is this a vasovagal response? Is this low blood volume, or he's just faking it? So the reason you know this is vasovagal is the heart rate is slow. It's the vagus nerve innervating the sinoatrial node and slowing the heart rate. And that's the quickest way you can tell if someone has low blood volume or a vasovagal response. So overactive vagal tone is the visceral response. Again, you've seen this before, goes sensory into the central nervous system, and then comes out this motor arm, the visceral autonomic nervous system, as mentioned in the earlier presentation on the autonomic nervous system. So you get a slower heart rate, your pulse lowers, and your heart rate contractility, or your heart muscle is reducing its strength of how hard it's pumping. Fainting is hypotension, lack of blood flow, oxygen to the brain. So there's a couple different ways to faint. It's the vasovagal, where your heart rate is slowed from the vagus nerve, or it's from hypovolemia, which is low blood volume. So the blood's pooling in the legs, someone is dehydrated or bleeding. That's another reason for a faint. Or and then the way you can tell the difference is by taking the pulse. In the vasovagal type of faint, the heart rate is going to be slow. In the person who is having dehydration or having like bleeding, internal bleeding, they're going to have an increased heart rate because their body's going to be increasing the heart rate to compensate for the low blood pressure. The words of advice: when you feel faint, get your head as close to the ground as you feel comfortable having your head bounce. So words of comfort: if you fall, I'll be there, and that's floor. So if you suspect anybody is feeling faint, saying they're dizzy, doesn't matter where you are, make sure you get them at least down, horizontal, get their feet up, even though it might be fairly embarrassing. All right, so the next one is the choke. We're going to talk about the performance anxiety. The top is how I see a test when taking it. Everything is just so confusing. And then how I see after a test after I get it back. And that's when things all seem so clear. What's going on with your brain at that point? Okay, so your heart is racing. First question. Your heart's racing. Which arm of the autonomic nervous system is most active? Review question. So your heart is racing, your heart's going very fast. Is which arm of the autonomic nervous system? Is it the sympathetic or the parasympathetic? Okay, so the answer is it's the sympathetic nervous system. Heart rate's going fast, fight or flight. This is the choke, when your sympathetic nervous system is starting to get overactive. And that's when you're taking a test or you're competing and you're at the tennis court and you're feeling this just overwhelming thoughts and you feel your heart going too fast, your hands are trembling, your palms are sweaty. This is a sympathetic stimulation. So that is where the body is preparing for fight or flight. Get a rapid heart rate, shallow breathing, sweaty palms, and the blood is, what's happening is the blood is shunting to the muscles, preparing for fight or flight to protect you from harm. And what happens with that is your performance suffers. Okay, so you feel your heart racing, your sympathetic nervous system has taken over. How can you stop it? A, take a deep breath to stimulate cranial nerve 10, which is your vagus nerve, which affects parasympathetics. Or B, take a deep breath to stimulate cranial nerve 10 to stimulate your sympathetics. Which is the correct answer? Well, the answer is cranial nerve 10 is a part of the parasympathetic nervous system, and the parasympathetic nervous system slows down the heart rate. So remember, we talked about how the vagus nerve also innervates the pleural cavity, the lungs. So taking deep breaths will help slow the heart rate and calm the autonomic nervous system. So remember, cranial nerve 10, slow down the heart rate. So in summary, what we talked about, the vasovagal response is a parasympathetic overactivity, and the choke is a sympathetic overactivity. So we have to find a balance between your sympathetics and your parasympathetics. And the result is deep breathing actually treats everything. Taking a deep breath increases pulmonary blood flow back to the heart and balances the autonomic nervous system. So for any situation, taking a deep breath is a way to bring that autonomic nervous system into balance so that you don't have an overriding sympathetic or parasympathetic nervous system. This is the balance. The answer is just breathe. Here's the autonomic nervous system, parasympathetic, an overactive cranial nerve 10, and the sympathetic is the choke. So this is a view of a babbling brook at one of the horticulture gardens. You don't always need a plan. Sometimes you need to just stop, breathe, trust, and let go and see what happens. Any questions, please include comments in my YouTube channel. Thank you.